And the coronavirus pandemic is not just a threat to our physical health, it's also taking a toll on our psychological well-being by exacerbating mental stress. Mobile journalist Pamela Vasquez gives us a front seat to the story.
The Philippines' battle with COVID-19 has been pushed on for more than a year now. And while community quarantines have been the go-to measure to curb infections, it is also seen as a factor aggravating mental health struggles for some.
Hello guys! Andito tayo ngayon sa Mount Caragao, dito sa Barangay Victoria.
While some people write journals, Melinda takes photos and videos for work or just for fun. But behind the contagious smiles are personal battles. In the middle of the pandemic, she left a decade-long career in media to work in the public sector. With all these changes came the anxiety and self-doubt.
I dread every day na kung papasok pa ba ako or not. Feeling ko, everything and everyone is already against me.
As the pandemic sped past its first year, the health department reported an increase in calls to the hotlines of the National Center for Mental Health. In the first quarter of the year, there were 3,000 calls to the hotlines, almost 900 of them suicide-related. Non-government organizations like the Natasha Goldburn Foundation also noticed a spike of hotline calls. The foundation was getting 60 to 80 calls a day, averaging 1,800 to 2,200 calls in the last 3 months. Roughly half of the callers are struggling through financial problems brought by the pandemic. But there are also students as young as 10 years old experiencing stress under the blended learning system. The anxiety and stress has spilled over to the foundation's social media page.
In our Facebook, we have already threats. I'm going to kill myself.
It doesn't help that there is a stigma associated with those seeking help.
We have to stop gossiping, rumor mongering, trying to figure out what really caused a suicide, what caused a mental depression.
Whether it is through a helpline or a helpful friend, Melinda says what matters is having someone to talk to and someone to listen.
It really helped me na may ibang nagbabalidate dun sa feelings ko.
COVID-19 does not choose who it hits. That goes the same for anxiety and depression. And while we're in the middle of a rising wave of cases, creating more fears and frustrations, it's important to be reminded that there are people and organizations willing to help. I'm Pamela Vasquez and we are One News.